Hi there, my name is Todd Steinhart. I'm the orthodontic specialist here at Advanced Orthodontics. Recently came on about 2 years ago, partnered with Dr. McCullough, who's been on the island here for 10 years. Really passionate about this practice. Believe it or not, this practice has been here for over 50 years with multiple orthodontists. So just really honored and proud and humbled to be a part of this team and of this legacy. So I'm from New Jersey, the Garden State, grew up, born and bred there, grew up with 3 brothers, parents in the fashion industry, so dentistry, it's kind of random, but it turns out my uncle's a dentist, my cousin's an orthodontist, so it kind of drove me into the field. Went to college not really knowing what I wanted to do. I knew I loved biology, I loved interactions with people, and I loved just the idea of maybe running a business one day. So going to school, kind of took the basic medical biology courses and kind of came to a point in my life where I said, had to do some deep diving and said, what did I want in my life? I talked to a lot of different fields of dentistry, medicine, and then I came up with, the fact that dentistry and orthodontics, it mixes art, science, and business and marketing. So those basically fit me, to the T. So I kind of went into dental school knowing that I wanted to be a dentist. And then kind of as I learned more about the specialties, I knew orthodontist was for me. As an orthodontist, you run your own business and your own team. So you get to be kind of a motivator and a marketer, and, you get the business side of things. Orthodontics also involves the art of the smile, the art of the face, making teeth fit together well, giving people great self-esteem, socially helping them out as well. So you get that gratitude every day from doing what we do. The hands, obviously we're in your mouth and we're very technical, so I get to use my dexterity every day, which is a lot of fun. But most of all, it's meeting new people and going on this journey. We in orthodontics, we're anywhere from a year up to 3 years, plus other family members and parents, and your patients become part of your world and your family. So every day I get the joy of greeting patients every day, going through their highs and lows, and then in the end, the gratification of a finished result and a happy patient. And in the end, you made a friend for life, which I think is amazing. So I couldn't have picked a better field for myself. And I've been around a little bit in orthodontics. I started out on the East Coast working on the Lower East Side of Manhattan in this small little shop next to a great pizza shop. And you'll learn pizza's my passion and food's my passion, but true New Yorker through and through. I met my wife in 2012, and we hit it off right away. She happened to live on the West Coast, I was on the East Coast, so the battle ensued. She lived with me for about 6 months while I worked in Manhattan, and then we finally decided we wanted to raise some kids on the West Coast. So came out here in 2013. I walked into a practice. I actually started a pediatric/orthodontic practice in the beautiful Palm Springs, Washington, Yakima, Washington. That was a very interesting start for me. I walked into a pediatric office that needed an orthodontist, so I built something from scratch there. Within about 5 years, we had built about 5 offices, and it was just an amazing experience for me. But we woke up one day and we said, we're ready to get back to home, which was Seattle, which was where my wife grew up. Wasn't Mercer Island yet. We ended up in Sammamish. So I bought a practice in Sammamish, and I actually ran and owned that for about 10 years. About 3 or 4 years ago, we decided, my wife's family is still on Mercer Island itself. They've been here for about 50 years now. Parents still live on the south end in the lakes. Brothers and sisters, cousins live here. So we decided that we wanted to live closer to home. So to my luck, Advanced Orthodontics and Dr. McCullough were looking for a part-time doctor while I was working elsewhere. Came here about 2.5 years ago, started working part-time and working into kind of a full-time operation, and really excited to be here. I always wanted to live where I worked, and I loved greeting patients at the store. I love seeing patients at the ball games. I just love that my everyday includes seeing people I know, seeing people I help every day. I couldn't have picked a better position for me, a better practice for me. So it's just been really exciting to come aboard, and Kara McCullough has been just a great mentor and partner, and she's got a legacy on this island like no other. Probably one of the better orthodontists that I've ever met as a person and as a practitioner. So I'm not only learning from her, but I'm adding to the practice for my business scope, because I have run a number of practices. And most of all, we're just having fun every day. And I always believe when you have a career and a job, if you're not loving what you do, you got to pick something else. And I can honestly say from the bottom of my heart, I wake up with a smile on my face every day, just excited to go to work, excited to treat the patients of Mercer Island, and excited to have my family close. My kids come in every day, come visit me. My wife's involved. It's just been a great fit for me, and I couldn't have picked a better place to work. So thank you, Mercer Island. And now a little bit about myself. So believe it or not, every orthodontist is a dentist. I'm a dentist. All dentists are not orthodontists, and we want to differentiate a little bit. And, I went to school for 4 years to become a dentist, so I can drill, I can fill, I can diagnose. You don't want me doing that anymore? I haven't done it in 20 years. But to become an orthodontist, you do have to go to extra training, because it is kind of a separate entity. We do things a lot differently than a traditional dentist would do with their 4 years of training. So I went to dental school for 4 years, then I did another 3 years of orthodontic residency, and in that residency, I focused on facial growth, tooth movement, biology of teeth, and generally how to give somebody a perfect bite, a perfect smile, and have them fit within the face. So, most of our patients come from referrals from your general dentist. Believe it or not, you can go to an orthodontist, especially including ourselves, without a specific referral. We do recommend that every patient sees us by the age of 7. It's recommended by the American Association of Orthodontics. Reason being, a lot of people think that orthodontics is just about straight teeth, but we're really focused on, one, the eruption of the permanent teeth. So when you grow up, you have 20 baby teeth up until your age of 6. Then you start gaining new teeth, but you're going to lose 20 of those teeth. So a big part of your early journey with the orthodontist is guiding those teeth, the adult teeth, into the mouth. So we do take very specific x-rays or panorexes that some dentists do or don't take that really show the eruption of teeth. Once we get to that point, we also talk about habits, thumb sucking, things that are affecting the mouth and the smile. We do look at severe crowding. Certain severe crowding cases, we will intervene early. We also look at growth patterns, underbites, overbites, things like that. So although most patients don't need treatment at the age of 7, we do recommend you come see us to get integrated into our office, to learn a few things about there. And another reason we also want to see you, a big topic of recent times has been the airway and breathing. We at Advanced Orthodontics have a very specific CBCT, which is basically a 3-dimensional x-ray that can assess your jaws and your teeth and your bite, but can also assess airway. So correcting problems early on with airway is super important. We're finding out more these days, so that's another reason we like to see it about 7 years old. So if you have any concerns about tooth eruption, about smile aesthetics, about your bite, your jaw, habits for your kids, or you just want to get that perfect smile or fix just this one tooth to kind of help you socially, help your self-esteem, I really think it'd be important for you to see us here at Advanced Orthodontics. Not only are we going to be your doctor and orthodontist, we're going to be your friend.